Hello, I'm Dr. Greg Winteregg. I'm a dentist and a partner at MGE. And today's video is the final in our series of Can You Really Get Out of Managed Care? And I want to say it again that I am not anti-managed care, I'm not anti-insurance, I'm anti-ripoff. And it's very sad and annoying to me to sit down with doctors who are doing dentistry for 50% of the usual and customary fee in their area. So today I want to take a look at now gathering up all of the numbers from the first video and really starting to evaluate it. Now, as you're comparing plans, there are three main numbers that you need to look at. First of all, how many patients are in the practice on this particular plan, and we're going to use the fictitious name Acme as an insurance company here. So how many Acme patients do you have? And how much money are you collecting monthly or annually from the Acme Insurance Company? Then you have to take a look at, thirdly, what is the write-off percentage? Now, this is a bit of a nebulous calculation. Maybe some of you have computers that can help you with this to zero in on a particular plan and what is the write-off percentage. There's usually going to be a couple of percentages. One is with regard to hygiene service, and the other is with regard to restorative service. Now, if that's hard to do, just randomly grab, let's say, a prophy service and a scaling and root planing service. How much are you writing off there compared to a crown? Like, what are you writing off with the crown? So now you've got a bit of a balancing act. You'll have a sheet of paper or maybe even a spreadsheet on Excel, and you have all the insurance companies' names listed, and then you'll have how many patients, what's the write-off percentage, and what's the dollar amount that's collected annually or monthly. Now, let's look at a worst-case scenario. You have an insurance provider where you only have 50 patients in the plan, only 25 showed up. Last year, you collected, let's say, $3,000 from those 25 patients who showed up, and you're writing off 50%. Well, that's one that you can drop right away with no impact on the practice, because the last thing you want to do is jeopardize the practice and get out of everything all at the same time. No. This needs to be done on a gradient. Now, a plan at the opposite end that you would probably want to keep is a plan that has 500, 600, I don't know, maybe even 1,000 patients. Your restorative write-off is only 10%. Your hygiene write-off is 10% or less, and they're accounting for 25 to 50% of your annual income. Keep them. Again, I'm not anti-insurance. I'm just anti-ripoff. So between the ones at the bottom that you won't even notice if they're gone, and the ones at the top that you want to keep, there's going to be all different kinds of gradients. And this is a decision that you're going to have to make. Maybe your accountant can help you. I suggest you start dropping the ones with the least revenue generated from that plan and the least number of patients and the highest write-off, and then you can start to stair-step them on up. Now, let's talk about dropping a plan. First of all, you must play by the rules. Look at your agreement and then do what they say. Some say that you must write a letter to the patient. Okay, then write a letter to the patient. Now, if you have to write a letter, you want to make it very clear you're dropping their coverage, you're not dropping them. They can still be your patient. It's just that you're not going to file the insurance for them, or the fees are going to be a little bit different. Have them come in for their next hygiene service. You'll talk about it, explain it all to them. And if this is done properly, over the years, we've been around for 25 years, what we're finding is you're only going to lose about 25, maybe 30% of those patients. Now, the patients leave. Keep them on a newsletter. Let them know that you still love them. You would still be happy to see them on an emergency basis. So just make it very clear that when you're having this discussion, you're dropping that portion of their plan. You're no longer in network. So it's very, very much of a balancing act. It's sort of like walking across Niagara Falls on a tightrope. But get some help, get some advice. If you would like, you can call me at the number on the screen, and I'll be happy to get into a little bit more detail with you as needed. But my recommendation is confront the numbers. Don't ignore it anymore, because this is probably costing you a huge amount of money for you and your staff in bonus. So that's my tip of the week. Good luck to you, and I'll see you back here again soon.